and you almost mention it, but you stop yourself. You step notice some changes down there, and you quietly wonder, is this normal? Here's the surprising truth. Studies show that over 60% of men over 60 worry about their penis size or shape. Yet almost no one talks about it, not even with their doctors. But today we will calmly, scientifically, respectfully. I'll explain what the average penis size really is, how to measure correctly and why it often changes with age, and what you can do about it. Stay until the end. I'll share a simple circulation trick urologists use to improve confidence and performance at any age. Before we start, I'm curious, how old were you when you first learned real facts about men's health? Comment your age below. You'll be surprised how many men feel the same. Many men in their 60s and beyond notice small but worrying changes, less firmness, a shorter appearance, or thinner girth. The truth is, these aren't just in your head. Aging affects everything, including blood flow, testosterone, and tissue elasticity. Yet, when it comes to size, misinformation runs wild. Magazines, internet ads, and myths have distorted what's actually normal. According to a 2023 review in the British Journal of Urology International, the average erect penis length is about 5.1 to 5.5 inches, 14 centimeters, with an average girth of 4.5 inches, 11.6 centimeters. Most importantly, normal has a wide range. Nearly 95% of men fall within 1 inch of these averages. But here's the hidden factor many seniors don't hear. Aging can cause a visual loss of about half an inch, not because the penis shrinks, but because fat at the pubic area increases and tissues lose stretch. The good news: circulation, posture, and even pelvic exercises can bring back a more youthful appearance. Have you noticed any physical changes as you've aged that surprised you? Not just there, but anywhere. How to measure correctly and why most men do it wrong. If you ever tried to measure at home, you probably did what most people do: grab the ruler and guessed. But medical measurement follows strict guidelines to ensure accuracy. Here's the professional method used in urology. Length, B-pole, bone pressed erect, length. Stand up straight. Press a rigid ruler against the top of the penis to the pubic bone. Yes, press gently through the fat pad. Measure to the tip of the glans. This removes variation from body fat or posture. Girth circumference. Use a soft measuring tape around the middle of the shaft while erect. Record in centimeters or inches. Flaccid measurement. Flaccid size varies drastically with temperature, hydration, and anxiety. Don't compare flaccid length to others. When seniors see shortening, it's often due to loss of elasticity and reduced blood pressure to the tissues, not an actual structural loss. And yes, certain medications, like blood pressure, prostate drugs, can influence blood flow. Did you know that medical measurements press the ruler to the bone? Most men don't. Why size can change with age and why it's that's not just shrinkage? Let's bust a myth. Your penis doesn't truly shrink with age, it changes form. 3 main factors drive this: circulation decline. Over decades, arteries lose flexibility. Blood flow to the pelvic region decreases, affecting not only erections but also resting tissue tone. Hormonal shifts. Testosterone levels fall about 1% per year after 40. Low T affects collagen, muscle tone, and fat distribution. Pelvic floor weakness. When these deep muscles weaken, blood doesn't stay trapped effectively, leading to a softer look. A study from the Cleveland Clinic found that men who performed pelvic floor exercises, Kegels, improved firmness and appearance within 3 months, even without medication. You can start today. Contract the muscles you use to stop urination. Hold for 5 seconds, relax for 5, and repeat 10 times. Do 3 sets a day. Have you ever tried Kegel exercises or heard of them for men?
How weight and posture change the visual length.
This is one of the most overlooked secrets. For every 10 pounds of extra belly fat, you can lose up to 1 inch of visible length.
Why? The fatty pad at the base of the penis pushes outward, covering part of the shaft. The penis itself hasn't changed, it's just hidden.
The posture adds to the illusion. When you slouch or sit often, the pelvis rotates forward, reducing visible projection. A quick fix. Stand tall, shoulders back.
Strengthen your lower abs and glutes.
Reduce belly fat with gentle daily walks. Even 20 minutes makes a difference. A 2022 Italian study found that men who lost just 10% of body weight regained up to half an inch of visible length. What kind of daily movement helps you feel more confident and upright? The psychology of comparison? What's normal? Anyway, the biggest source of anxiety isn't physical, it's emotional. Most men's only comparison point comes from media or locker rooms. But research shows the average man underestimates himself and overestimates others. In one study, 68% of men who thought they were below average actually measured within normal range. Comparison steals gratitude. Function matters far more than numbers. Intimacy, blood flow, and self-confidence are better predictors of satisfaction. If you ever feel discouraged, remember your body has carried you through decades of life, wisdom, and experience. Improving health is about function, not competition. How to support size and function naturally? Here sits where science offers hope.
Certain lifestyle and nutritional habits can improve vascular health and indirectly penile performance and appearance.
Top 3 evidence-based supports. Nitric oxide foods.
Beets, spinach, arugula, and pomegranate help open blood vessels. A Harvard study found that men with higher nitric oxide levels had significantly firmer function scores. Sleep and stress.
Poor sleep reduces testosterone and growth hormone. Aim for 7-8 hours. Practice calm breathing before bed. It's medicine for your circulation. Avoid smoking.
Even light smoking constricts small arteries. Quitting improves erectile blood flow in as little as 2 weeks.
When to talk to a doctor.
It is easy to think I am too old to bring this up.
But urologists hear these questions daily. Changes in size or function can sometimes signal vascular disease, diabetes, or hormone imbalance. Red flags to mention. Sudden shortening or curvature. Pain or plaques, possible Peyronie cyst disease. Ongoing erectile difficulty.
Modern treatments are discreet and effective, from shockwave therapy to low-dose medications and hormone balancing.
Don't let embarrassment block your health. A quick chat can reveal reversible causes. The urologist said circulation trick.
As promised, here's that circulation boosting technique used by many urologists to improve blood flow naturally. It's this called the warm compress protocol.
Warm not hot towel on the groin area for 5 minutes daily. Follow with gentle pelvic floor contractions. This improves microcirculation, elasticity, and oxygen delivery safely and without medication.
Combine that with nitric oxide-rich foods, posture work, and Kegels, and you'll see noticeable vitality within weeks.
The real average size. How to measure correctly. Why aging changes appearance. And what you can do to restore confidence and function naturally.
Remember, it's not about chasing numbers, it's about blood flow, health, and vitality. Your body can still adapt, strengthen, and thrive at any age. Which of these habits will you try this week?
What surprised you most about the real averages?
And what men-sets health topic should we cover next?
Subscribe. Without it, you'll miss the next breakthrough. YouTube won't remind you. Like when you like, this spreads to more seniors who need calm, honest health talk. Comment. Your answer might help another man watching tonight. You've earned the wisdom of age. Now let's protect the health that keeps it shining.
I shall see you in the next video.